Hi folks, this is John Adamson, the Rehab and Documentation Guru. Today is November 18th, 2019, and I'm going to get back to clinical discussion now because I've been kind of off that topic and off the topic of documentation, and I wanted to bring up a little case study. So I saw a patient today who had a left total hip replacement roughly a month ago. But what happened after his hip replacement was he went through a lot of medical issues. Basically, has a pretty extensive medical history, had some electrolyte issues, hormonal issues, and he had a lot of distal edema and was just not doing well. He got home and his wife literally could not take care of him and he could barely transfer. Not the typical orthopedic patient, status post total hip. So both myself and the nurse encouraged him to go to the hospital, which he did, was admitted, got medically treated, took several days, and then he went to inpatient rehab for a couple weeks, and now he's back home. And so anyway, this guy presents as a typical total hip in some respects. He's recovering from that. He's got virtually no pain. And so the reason for the referral in the first place was post-op total hip replacement. And so when you look at just his hip performance, he was doing outstandingly well. He had today a 1 out of 10 pain in his hip. His active range of motion was virtually the same. But he has comorbidities and complexities, and I want to just address those real quick. One of his long-standing health issues is peripheral neuropathy, and he wears bilateral MOFOs, molded ankle-foot orthoses. Because of that, he's got nothing at the ankles, has had that for several years. He's also been walking with a rollator for several years. And prior to his rapid decline with his hip, he was able to go shopping at Walmart. He'd push a cart, but he'd get around the store, no problem. But he's had this gait anomaly and concurrent balance issues for a long time. So in my evals, I've got in my EMR, which is Epic, I've got 2 standardized tests that are pre-built into it. One is the Tenetti, one is the 30-second chair rise. So on the 30-second chair rise, this guy at the age of late 70s scored at a 6 repetition level modified, meaning he used his hands. And I often allow my patients to do that because still, if they can gain a couple points or more on the 30-second chair rise, that's still statistically significant. But age normative for this guy should be 11 reps or more. So he's well below that. Not only is he well below the actual number, but by modifying it, by using his hands, that's a further demonstration that he's definitely weak in the lower extremities. So that's an underlying impairment. Can we relate that to his just recent event of his total hip rather than his pre-existing conditions, which I'm not treating? And the answer is I clearly would think so, because he's obviously exacerbated, based on what he's been through medically over this last month, exacerbated some of his problems he had previously. So that's one significant finding that I can address. The other I took was the Tenetti. It's pre-built into our system. And he scored a 14 out of 28, which, is high fall risk, not good. But if you look at his balance section, he scored a 6 out of 16. Now, most of those items, he scored poorly as soon as I asked him to try to balance without using his hands. And really, he's got terrible, obviously, somatosensation. He's got peripheral neuropathy. Of course, he's fixed with these MOFOs. They're solid ankle. He's got no ankle movement to gauge where he is in space. No proprioceptive awareness there. So he's not using that system for balance. So he's trying to balance, and he's clearly not balancing well. And I'm guessing this guy's got long-standing visual and or vestibular issues as well, not related to his total hip. And so he scored 14 out of 28. His gait was as good as I think it was going to get. And I told him up front, based on his score and based on his history, I didn't think I was going to make a difference in that area. So I think I'm going to improve strength on this guy. I don't think I'm going to improve balance. I kept him for a very limited frequency and duration, 2-week 2. And what I'm going to do is I'm going to work with him on a home program. He's also got spinal stenosis, and those are always tricky patients to work with hip exercises. because you might exacerbate their symptoms. And because he's gone through this recent medical issue, he's definitely declined in conditioning, but general conditioning is not something that Medicare covers our services for. So I'm going to probably see him the 2 week too, play with his home program, find the best solutions for him to work on his strengthening, which is going to impact his functionality. But beyond that, there's really not a lot I can do. I can teach him to compensate for his balance, but he's been dealing with it for years, and he's doing a good job of it already. He's got a lot of good equipment. Environmentally, one of the big concerns I have is as soon as this guy closes his eyes, he's going to have no balance whatsoever. And so I'm going to look at some environmental factors that might be contributing to fall risk in his environment. So I'm not going to improve his balance. I can definitely work on compensations, but he's likely learned most of them. I can work on environmental, but one factor I can work on is his motor performance, which is strengthening. So that is going to be my focus for improving impairments. Those of you that have been to my course, I've talked about ICE, the care plan model for doing well-rounded care planning for your patient. And so anyway, that's how I'm approaching his care. And so anyway, I just wanted to share a little bit of a case study today and get back to a little bit of clinical, because we've been kind of delving into other topics. By the way, if you have a subject matter expert that you know that would make somebody that'd be good to interview, please shoot them a message and tell them to get in contact with me. I'm looking to expand my subject matter expert interviews in the future. Anyway, hope you enjoyed. Take care, God bless, and have a great day.